You don't need the textbook. I know it can feel like you need to read a textbook on labor and delivery, but today I'm going to tell you the one thing that you do need as you go into your hospital birth. In case we haven't met yet, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am here to get you prepared, not scared, for your upcoming hospital birth. And if you've been here before, hello, welcome back. One of the ways I think you can best get prepared is by getting your birth preferences under your belt. I have a whole birth plan video, printable that you guys can grab. I'll put the link down below. Okay, so what is the skill that you need before you go in for birth? And honestly, nobody talks about this, so I'm really excited that you're here today. That skill is knowing how to make decisions for yourself when the time comes. And as I say that, you're saying, Hillary, why did you just tell me to download the birth plan if I can only make decisions when the time comes? Well, birth plans are a great way to start thinking about what you'd like, what your priorities are, because everybody's different, but you still got to make the choices when the time comes. So let me give you a few things. On your birth plan, you might have said, I do not want to be induced. Great. I think a lot of people feel that way. However, if you get into your appointment and all of a sudden baby just isn't growing in the womb as they would like, baby looks a little bit small, and they're thinking, I think baby would flourish more if we got him outside earlier. You might decide that getting induced is a good plan for you at that time. Another example, you don't want a cesarean. In fact, most people don't want to have a C-section. But if you're in labor and baby's heart rate keeps dropping with contractions and you're not progressing, you may decide that a C-section is the best option for you at that point in time. Again, you're making the choice at that point in time. I think a lot of times people think that a birth plan sort of manifests the right things for you. And I gotta say, I feel like the more you're tied to either those big things like not having an induction or not having a C-section, they end up looking worse when you have your birth. I think knowing what you would like is awesome, but being so tied to it that you aren't able to make those good choices at the time really ends up being detrimental to you and your birth. And honestly, this is not a skill that most people are great at. A lot of times when we ask you what you want to do, baby's looking small, heart rate's going down, I just sort of get blinks. And people just aren't sure what they want to do because they haven't built that skill to make choices at the time. As a mom, I've told my kids, we're going to make some choices ahead of time. Like, we are not going to do drugs. We are not going to sleep around with people that we don't care about. But you go to the hospital and your appendix is rupturing, you might make the choice to do drugs right then. So it is a lot of just making the right choices at the right time for you. And it's a skill that we all need to get better at. Today, I want to give you 3 ways to strengthen those skills as you move forward. The first one is to make choices at your prenatal appointments. Now, a lot of times prenatal appointments, especially those early ones, just flow really easily. Your doctor's just checking basic things. You may not have a lot of input. They might ask if you have any questions, and it's so early you aren't even sure what to ask. And so you get in a habit of maybe not asking questions or not making choices for yourself. So the biggest thing you can do is when they recommend something, ask them why. Let's say they say you need an ultrasound. You're 8 weeks pregnant and you need an ultrasound. Just say, hey, why do we do that ultrasound? So you can start building that muscle. You may, in fact, already know why you're doing that ultrasound, or you are just so excited to see your baby. You're like, why on earth would I ask why? But start asking that question because it is building those muscles to get you prepared to make choices later on. Now, of course, you're likely to want to get that ultrasound. It's so exciting, totally there with you. But I want you to realize inside yourself, you're making the choice to get that ultrasound. It's not your provider making that choice to get the ultrasound. It is up to you. You're making a choice. A couple more examples. Your provider talks about aspirin and says, I think you should be taking some aspirin. And they don't really go into why. Ask why. Why should I be taking aspirin? And then they can list the risk factors that you have that might decrease your chance of getting preeclampsia if you take aspirin. And again, you're making the choice to take that aspirin. It's not your provider forcing you to take aspirin. Let's say you get into that 3rd trimester and like we talked about before, baby just isn't growing as well and they recommend an ultrasound. Ask why. Then they're going to go on to tell you about what the ultrasound might show, what the consequences might be. You are then going to have a heads up that this could mean that you might need to make the choice about an induction. And ultimately, remember, you're making the choice to have the ultrasound. And when the time comes, it will be up to you to make the choice about being induced or waiting a little bit. I actually have a whole post on what to do if your doctor says you have a big baby, and I get that question a lot, so I'm going to put the link down below. The second thing to build your strength is to not avoid making choices. Now, it can be really easy to avoid making choices during your pregnancy, but then I hear a lot of people saying, oh, my doctor made me get an ultrasound. But I can tell you that I know your doctor did not come and carry you to the ultrasound. You ultimately made the choice to go and get the ultrasound, even if you felt like your provider was telling you to do it or you felt forced. What I want you to do is start making the choice. I made the choice to go get an ultrasound off the recommendation of my provider because ultimately you are just paying your doctor or midwife to be the expert in the room. You are taking their information and making a choice for yourself. Now, I actually run a home organization class because why not? And I see so many people just avoiding making choices, which ultimately makes them have a house full of clutter, hello hoarders, or just an inability to find the things that they need or put away the things that they do need into good spots because they're just full of too many choices that they never wanted to make. People avoid choices, and I totally get it. When I go to declutter an area, it just fatigues me because it's difficult to keep making constant choices. But it feels so good when you've decluttered that area and you've made those choices and are moving forward in a positive way. So today I want to encourage you to, number one, start asking questions. Don't forget to ask why. Number two, make the choice. Remember, you are always making the choice. You are not being forced into do something. And number three, remember, you can always change your mind. If you make the choice to not be induced and you want to get another ultrasound in a week, and then it looks like baby isn't growing any better, you can then make the choice to be induced. Being able to change our minds is awesome, and I appreciate that as an option. Not sure my husband appreciates me being able to change my mind. Okay, here's a pro tip. I actually see a lot of people getting a doula because they sort of want the doula to make the choices for them. And I'm here to tell you that a good doula absolutely does not make choices for you. They can encourage you to ask the whys, to get questions answered, and to make those decisions on your own. But a good doula does not make choices for you. So if you're looking to have a doula so that they'll sort of be the expert in the room to make choices for you, that is not their job, and it should not be their job. Okay, number three on building strength to make choices in your pregnancy and birth is to get the basics down. Now, so many people think that they are going to their prenatal appointments and that time is for your provider to educate you about your upcoming birth. And they may be able to do a little of that during those very short appointments. However, those appointments just aren't long enough to teach you all of the basics, plus check on your health and make sure that things in your pregnancy are progressing well. That is why you need to take a high quality birth class to give you that foundation that you need to make choices on your own. A high quality birth class is going to talk about third trimester testing, so you don't have to ask 5 million questions about it. When your provider says, hey, I think we should do an NST, you understand what an NST is, and then you can ask why you are getting an NST and what the implications are. So you're skipping that whole part about like, oh, what is an NST? What am I going to expect? How long is it? If you take a good birth class, they're going to cover all of that for you in advance. A good birth class is going to tell you how to labor at home, what you can be doing at home to help your labor progress and also not lose your mind while you're trying to decide if you're actually in labor. A good birth class is going to talk about natural pain management. Now, I see a lot of birth classes who seem to only cover natural pain management. And as I hope you've learned in this video, that is not the number one thing that you need to know about your upcoming birth, but it is a part of it. And I think a good birth class is going to help you give you those basics so that you can make choices for yourself once you're in the hospital. And finally, a good birth class is going to give you some basics on inductions and C-sections so you understand what those things are in case you need to make that choice as you go into your delivery. Now, I'm not here to say that you need to understand the chemoreceptors and the baroreceptors and how it's affecting your blood pressure. That is your provider's job. They're the expert in the room who really needs to know about the science and the research so that he can give you his expert opinion. But it really is up to you to learn how to make choices for yourself. As I said before, there's a lot of birth classes that really focus on natural pain management and don't focus so much on what can go on the hospital, as well as empowering you for your upcoming hospital birth. The online prenatal class for couples is the class that prepares you to do all of those different things. It really is in there reminding you that you get to make the choices. This is what normally happens, but it's so important that you make a choice based on the priorities that you have. And I think that that really decreases birth trauma and honestly increases overall health for everyone involved. The online prenatal class for couples is totally doable. The basic class is just 3 hours long. It's taught by an unbiased expert that you can trust. It's actually also budget friendly. I see so many of the classes here costing like $300-$400. This class is not in that range at all. You'll be surprised at how cheap it is. And the good news about that class is it's also going to help your partner support you, which is so important. They're going to feel empowered, you're going to feel empowered, and you're going to go in like teammates to make this a great birth. Okay, tell me, how good are you at making choices about birth? How confident are you feeling for the labor room? I actually have a whole video about feeling confident in the labor room that I think you guys will enjoy checking out. But tell me down in the comments how confident you're feeling and how good you are at making choices, because I think this is something we can all work on.